Welcome to this informative video about inflammatory glaucoma. Glaucoma, often referred to as the silent thief of sight, is a group of eye diseases that damage the optic nerve, which connects the eye to the brain. Inflammatory glaucoma is a specific type of glaucoma that arises as a consequence of inflammation within the eye. Join us as we delve into the causes, symptoms, diagnosis, and treatment of this complex condition. Inflammatory glaucoma is primarily caused by inflammatory conditions affecting the eye. These conditions can include uveitis, which is inflammation of the middle layer of the eye, also known as the uvea. Other causes include herpetic eye diseases like herpes simplex or herpes zoster infections, cytomegalovirus retinitis, and even trauma to the eye. Systemic inflammatory diseases like rheumatoid arthritis, lupus, and sarcoidosis can also manifest with ocular inflammation leading to glaucoma. Rarely, certain medications can trigger inflammation that subsequently causes glaucoma. Inflammatory glaucoma develops through a multifaceted process. The inflammation within the eye leads to the release of inflammatory mediators. These mediators disrupt the normal drainage pathways of aqueous humor, the fluid that fills the front part of the eye. This disruption can occur through several mechanisms. Firstly, inflammatory cells and debris can physically block the trabecular meshwork, the primary drainage structure. Secondly, inflammation can cause scarring and structural changes to the drainage angle, the area where the cornea and iris meet, further impeding outflow. Thirdly, in some cases, inflammation can lead to the formation of peripheral anterior synechiae, which are adhesions between the iris and the cornea, closing off the drainage angle. All these mechanisms cause a buildup of intraocular pressure, IOP, which damages the optic nerve, ultimately leading to glaucoma. Accurate epidemiological data specifically for inflammatory glaucoma is limited, as it is often considered a secondary glaucoma resulting from an underlying inflammatory condition. However, we do know that uveitis, one of the major causes of inflammatory glaucoma, affects a significant portion of the population, with an estimated prevalence of around 50 to 70 cases per 100,000 people. The incidence of uveitis-associated glaucoma is estimated to be approximately 4 to 20% of all uveitis cases. The actual numbers may be higher, as inflammatory glaucoma can often be underdiagnosed or misdiagnosed. The occurrence of inflammatory glaucoma varies depending on the geographic location and the prevalence of specific inflammatory conditions within those populations. The signs and symptoms of inflammatory glaucoma can vary depending on the underlying cause and the severity of the inflammation. Common symptoms include eye pain, redness, blurred vision, and light sensitivity, also known as photophobia. Patients may also experience halos around lights and a gradual loss of peripheral vision. In some cases, the inflammation itself may cause discomfort, and the increased intraocular pressure can exacerbate the pain. It's important to note that some individuals may have inflammatory glaucoma without experiencing any noticeable symptoms, especially in the early stages, hence the importance of regular eye exams. Diagnosing inflammatory glaucoma involves a comprehensive eye examination. The ophthalmologist will measure intraocular pressure using tonometry. They will also examine the drainage angle using gonioscopy, which allows them to visualize the structures and identify any blockages or abnormalities. A dilated fundus examination will be performed to assess the optic nerve for any signs of damage. Visual field testing will determine if there is any peripheral vision loss. Furthermore, it's crucial to identify the underlying cause of the inflammation, which may involve further investigations, such as blood tests to check for systemic inflammatory conditions or imaging studies of the eye to assess for structural changes. Inflammatory glaucoma can be broadly categorized based on the underlying inflammatory condition and the mechanism of IOP elevation. One common classification is based on whether the drainage angle is open or closed. In open-angle inflammatory glaucoma, the trabecular meshwork is primarily affected by inflammation and debris. In angle closure inflammatory glaucoma, peripheral anterior synechiae or other structural changes block the drainage angle. Another way to classify inflammatory glaucoma is based on the type of inflammation present. For example, uveitic glaucoma refers specifically to glaucoma caused by uveitis. Herpetic glaucoma results from herpes infections, and steroid-induced glaucoma can result from prolonged use of steroid eye drops. The treatment and management of inflammatory glaucoma focus on controlling both the inflammation and the intraocular pressure. Topical corticosteroids, such as prednisolone or dexamethasone, are often used to reduce inflammation in the eye. Cycloplegic agents can help to relieve pain and prevent the formation of posterior synechiae, which are adhesions between the iris and the lens. To lower intraocular pressure, eye drops such as beta blockers, alpha agonists, carbonic anhydrase inhibitors, and prostaglandin analogs are commonly prescribed. In some cases, oral medications may be necessary to control inflammation or lower IOP. Laser procedures, such as selective laser trabeculoplasty, or SLT, can help to improve fluid drainage. When medications and laser treatments are not sufficient, surgical options, such as trabeculectomy or glaucoma drainage device implantation, may be considered to create new pathways for fluid to leave the eye. Preventing inflammatory glaucoma involves managing the underlying inflammatory conditions effectively. Regular eye examinations are crucial, especially for individuals with uveitis or other risk factors. Prompt treatment of ocular inflammation is essential to prevent structural damage to the drainage pathways. Patients using steroid eye drops should be closely monitored for signs of increased intraocular pressure. Following the ophthalmologist's instructions carefully regarding medication use and follow-up appointments is also vital for prevention. The prognosis for inflammatory glaucoma varies depending on the severity of the condition, the underlying cause, and the response to treatment. Early diagnosis and treatment are crucial for preventing or slowing down the progression of optic nerve damage. While some individuals may experience good control of their intraocular pressure and maintain their vision with medication and regular monitoring, others may require more aggressive interventions. Recent research is focusing on developing new anti-inflammatory therapies that specifically target the inflammatory mediators involved in glaucoma development. Gene therapy and targeted drug delivery systems are also being explored as potential future treatments. The long-term goal is to find more effective ways to control inflammation and prevent vision loss in individuals with inflammatory glaucoma.